back to Body Beautiful. Right now we're talking with Dr. Elizabeth Lee about skin protection and the sun. We'll be taking your calls with any questions you have. The phone number 800-440-4884. We'll also be posting the number for the doctor's office during and at the end of the segment. Remember, any advice we give you today, you certainly want to also consult your own physician as well. Let's go straight to the phone lines because we got a lot of phone calls.
Absolutely.
James from San Mateo, you have a question about children in the sun.
Yes, my question is, my wife takes my 2-year-old to the pool about 3 times a week, about an hour and a half each time. And my daughter is really, really dark. My wife contributes that to her being half Mexican and she's half Irish. But I'm concerned about, for a 2-year-old being at the pool that much, getting that
well,
stuff.
I think that it is appropriate for 2-year-olds to be at the pool during the day. I think that there are ways, you're correct to be concerned about the amount of sun exposure that she's getting. As we talked about in the last segment, just having dark skin doesn't protect you from skin cancer. And we do know that most of the damage that causes skin cancer occurs early in life. So there are ways to go to the pool to practice safe sun. She should be at the pool early in the morning and late in the afternoon. Peak sun times, where the sun is coming directly through the atmosphere, has been expanded actually to between 10 and 4. There are, in addition to sunscreens, which will contain zinc oxide and need to be reapplied, particularly if she's in the water, and should be applied 30 minutes prior to her going outside, she can be covered up. There are shirts that are designed specifically to be in a swimming pool and to be comfortable for children that reflect a tremendous amount of the sunlight. There are also hats. But if you can't wear a shirt and you can't wear a hat, use sunscreen and try to be out during the times where the sun is not at its strongest.
All right, Dr. Lee, one other part of the body that's exposed to the sun that seems to have, is affected by too much of it is the eyes. Sunglasses, good idea to start?
Sunglasses with UV protection are a very good idea. Light eyes are more prone to problems related to sun damage than are dark eyes, but dark eyes can develop problems too. So just because you have brown eyes doesn't mean that you're safe.
So we're talking about macular degeneration. They see a correlation there between too much
and
sun.
Also cataract. And I'm not an eye specialist, but there's no question that there's a whole list of things that can happen to the eyes related to UV damage.
All right, James, hopefully we answered your question there. A nice hat,
cover up, and watch the hours that you're out.
Sunglasses. And 10 o'clock, huh? Nothing between 10 and 4?
Are the current recommendations. Certainly between 10 and 2.
Okay. We've been talking about, just the exposure and sunburns, but really the killer out there is something called melanoma.
Yes.
And this is something you don't mess around with.
Well, none of the skin cancers are skin cancers that should be messed around with or taken lightly. But melanoma, unlike the other 2 major ones, which are basal cell carcinoma and squamous cell carcinoma, melanoma has a very high, what we call mortality or incidence of causing death. Okay,
we have a chart. Let's go ahead and put that up so we can get an idea what these look like. These are melanomas, right? Or
well, I believe that the column on the left are the benign ones,
yeah.
and the column on the right are the aggressive melanomas. And this is always a nice chart for the public to be aware of. I mean, you see changes that can go on, but I hesitate to use a chart like this because I want the public to understand that they're not expected to do screening of their own skin cancers. I mean, this is one of the things that doctors need to do. You should always start with your primary care doctor. You should be seen once a year. If that primary care doctor sees something, then you should be referred to a dermatologist who specializes in looking at things and assessing them. Obviously, if your husband bends over and you see something that scares you or looks like this on the back, go directly to your doctor. Don't wait.
So one of the most frightening aspects of this is this could be the tip of the iceberg. You may not see anything that's obvious, right?
Correct.
And yet something beneath the skin can be
Well, in most melanomas, they are visible. Most melanomas are visible on the skin, not all of them. And certainly a changing mole is one of the things that we always tell people to worry about. You see a mole if it starts to bleed, if its edges become less well defined, if the pigmentation changes within it, by all means, run.
Well, I had a friend who had what she thought was a pimple that just wouldn't go away.
And it turned out to be a basal cell carcinoma.
Yes. Right. Okay, we've got to take a quick break. We're going to talk more with Dr. Elizabeth Lee about safe sun when we come back. We'll also take your phone calls.